So let us begin with Alan's keynote study streak and the remedy we have been discussing in the past few sessions are related to the female reproductive system and the hemorrhagic remedies. And today is one such similar remedy that we will be discussing. So glad to see Dr. Pujit Kumar, Ruturaj Chaudhary, and someone named as Soulful Omya Yogi. If you have been attending my past few sessions, I mean it's going on since the last 2 to 3 months. Alan's keynote study streak, daily one or few remedies from Alan's keynote studies from Alan's keynotes which are related to the previous remedy or something that is pending from the study. There are many peculiar symptoms, physical particulars especially, that you will get in Allen's keynotes, and if you master Allen's keynotes, then your journey in homeopathy is going to be very easy. You will require less time for case taking, and you will be able to look into the next remedy which is needed for the patient at the earliest, or there are chances that you will reach the right remedy very soon because of the physical particulars and physical generals which are mentioned really beautifully in Allen's keynotes. So I started this Allen's keynote study streak, and today we'll continue with another interesting remedy which is also hemorrhagic in nature. The remedy is Hemamelis virginica. The shrub flowers from September to November when the leaves are falling. The seeds mature the following summer. So there is a lot of importance for the plants and the minerals about how they act or behave when they are in their crude form. If we understand, we will be able to help the patients much more faster. I'll give you an example. Phosphorus is an element which glows in the dark. Phosphorus as a personality will be someone who is the life of the party, who is much more exuberant and exhilarated than anyone else you have seen. So that is the essential nature of phosphorus as a element in the crude substance. It has been transferred to the individual, or the individual vibrates at that frequency where we need to give him phosphorus. So similarly, there are different remedies and different connections we need to establish where you can understand the elements in crude form and then try to correlate how the personalities behave, or vice versa. Going further in Hemamelis, we have wounds, which is incised, lacerated, contused, injuries from falls, checks hemorrhage, removes pain and soreness, like the remedy arnica. So it is a remedy which is like arnica, maybe a deeper than arnica remedy, where the hemorrhage or the contusion is much more deeper, or there is a lot of bleeding which is happening. Chronic effects of mechanical injuries, Conam is one of the remedies that is mentioned over here. Profuse discharges which stimulate a hemorrhage and from a drain upon the system as severe as a loss of blood. Many times we will have patients like, for example, piles, or we will have patients who are just coughing. There is no cause found in hemoptysis. There is some other issues which uh, you know got that stage of elimination of blood through the sputum. So that is the same situation for Hemamelis to be prescribed. You will see that there is hemorrhage, there is profuse discharges which look like dark brown or look like hemorrhage. They simulate a hemorrhage. That is what is mentioned. Bad effects from loss of blood. China is one of the top remedies we think of. Hemamelis is also a remedy we should think of when there is lot of fluids, especially blood that has been lost by drainage, by incision, by a wound, by an accident, and we need to give a remedy, and we are thinking that we should give calendula, we should give arnica, and It's a combination. Hemamelis is a combination of conium, arnica, calendula, and china. There is lot of weakness, lot of hemorrhage, and contusion of the parts. Bruised soreness of the affected parts. Arnica is one of the top remedies. You have hemamelis also over here. Rheumatism, articular and muscular. So the muscles are weak because of overstrain. Same is the case with arnica. Same is the case with hemamelis. There will be modalities which you will need to differentiate, and we'll come to it at the end of the session. Next you have in hemamelis is the eye complaints, traumatic conjunctivitis, suggulations, extravasations into chambers of the eye from severe coughing, intense soreness. So all the patients who develop lot of cough and have damaged their eyes or other parts of the body due to coughing or sneezing or persistent issues which involve the other parts of the body but have caused damage in the reflective organs, that is a place where we can give hemamelis. Arnica, calendula and ledum are mentioned over here, but hemamelis can be one of the top running remedies for you to prescribe. Next you have is nosebleed, passive flow, long lasting, blood is non-coagulable. So someone whose prothrombin time is pretty much extended, you will get it from the reports. This little things are minute observations that you can do from your patient's reports. If he is a heart patient, if he is having some sort of bleeding, he is put on medicines to stop the bleeding, and you see the prothrombin time which is pretty much longer than what is normally should be, you should think of hemamelis. Blood is non-coagulable. Crotalus horridus is another very similar remedy. And profuse headache, profuse bleeding causes a better feeling in the headache, which is similar the case with melilotus. The nosebleed is idiopathic, there is no cause found, traumatic or vicarious, or it can happen in childhood also. So many times you will have patients who have no pathology, no polyp noticed, no nasal or throat pathology, but even then they report to you that there is bleeding that is happening and there can be epistaxis. Think of hemamelis as one of the top remedies instead of going for something like arnica or something like finding a cause and then prescribing. Without any cause, you can think of hemamelis. So we have a few joinees on the Instagram like Dr. Diksha Mishra, sorry, Dr. Shailendra BFR, Dr. Shrisha Durgam. Glad to see everyone. And if you have attended my previous sessions or not attended, it's a good chance to catch up with Ellen's keynotes. This is going to be your book, your go-to book in the early days of practice, or where you will need uh, therapeutic pointers to remedy, and this is the book that will give you the best therapeutic pointers to decide which remedy to be given and which is not to be given. So we are at the remedy hemamelis. You have respiratory system, hemoptysis. We saw in nose there was epistaxis, in eye there was some extravasation into chambers of the eyes. Same we have for respiratory system, hemoptysis, tickling cough with taste of blood, sulfur, venous, without effort or coughing, sometimes monthly for years. So what do you see? Sometimes for years. When these lines are mentioned, it is going to be a concomitant symptom which the patient probably would have neglected all through the while. There will be minor instances once a week or once in 15 days of these hemoptysis which the patient would have had, but he forgets to tell you that in your case taking. When you take the entire case and you seemingly find to think that hemamelis can be one of the remedies, you can go over and ask this question and you will probably get more than positive answer towards this remedy. Next you have is hemorrhage from the GIT, gastrointestinal tract, which is profuse dark grumus from ulceration of the bowels. Crotalus horridus is one of the other remedies which is very similar. So in fact the next remedy which we will discuss tomorrow is going to be tomorrow or Monday will be Crotalus horridus itself. Hemorrhoids are profusely bleeding, with burning, soreness, fullness, heaviness, as if the back would break, urging to stool. There is bluish color, anus feels sore and raw. After hemorrhage from piles, prostration out of all proportion to the amount of blood lost. Hydrolysis is one of the remedies, hemamelis is one of the other remedies. So many times you will have patients who will tell you that there is lot of bleeding, lot of bleeding, and I have collapsed. Sometimes the patients will tell you that bleeding happened just one day, but I'm feeling weakness since the last 7 days. We are thinking I have usually prescribed China in excess bleeding cases, Sorainum in excess bleeding cases. Hemamelis is a remedy which will have weakness out of all proportion to the bleeding that has happened. You can think of prescribing it, especially in bleeding piles or in hemorrhage from the GIT system without any early cause detected. It is going to stop the bleeding and kind of modify it, if not cure it, for laying down the prescription for other remedies. Next we have CVS, cardiovascular system. There is mention for MMLAs in Allen's keynotes that it is adapted to venous hemorrhage. Every orifice of the body, nose, lungs, bowels, uterus, bladder, causes venous hemorrhage, or kind of the blood is dark and kind of from the venous outlets. There is passive congestion of the skin and mucous membranes, phlebitis, varicose veins, ulcers, varicose with stinging, pricking pain, and hemorrhoids. So, how will you find this in patients? Patient will give you complaints in two areas of their body. They'll tell you that they have varicose veins since the last 10-15 years, and now they have developed hemorrhoids. Hemorrhoids with varicose veins, one of the top remedies you can think is hemamelis. Next is, there will be patients who will develop varicose vein ulcers, which will have kind of a pricking type of pain, stinging type of pain, and the development of hemorrhoids in the beginning phase. You can think of hemamelis as one of the top remedies. And there is these the vessels, the blood vessels are kind of jammed, coagulate, uh, it's like a thread which is crumpled to a large extent, which you will see in the venous appearance of the veins of the calves, that will lead you to prescribe MLS. Is the aconite of venous capillary system. Patients are subject to varicose veins, takes cold easily from exposure to warm or moist air. Next, you have female reproductive system, uterine active or passive hemorrhages after a fall or rough riding. There is vicarious menstruation, no mental anxiety. So, in spite of the bleeding which goes on for 5 days, 7 days, 15 days, more number of days than what is indicated, the patient will be pretty much relaxed, and you can confirm that from the patient. What are your feelings? One of the top questions that I have been asking patients in their diseases is that what do you feel about the illness? Sometimes they tell that I am very much anxious, what will happen next? Sometimes they tell that I am very much sad. Sometimes they feel that no, there is no as such strong symptom in the mind for the disease, but yes, it should get well. So it's a no concern which they are showing, and when they show this type of lack of concern, or they are busy in other worldly things but to focus on their disease also, you can think of MMLS. They will not be having any anxiety. There will be passive or active hemorrhage. We saw this also in Trillium pendulum. It's also there in Millefolium. Menses flow is dark, profuse with soreness in the abdomen after a blow on the ovary. One of the top remedies that you can think of for blow on the abdomen or ovary causing PCOD or ovarian complaints or PID is going to be Belispar, is going to be Staph, is going to be Hemamelis. So remember these remedies, especially if Hemamelis can be indicated if the bleeding has been persistently dark in nature and the patient does not have any mental anxiety, or all suffering aggravated at menstrual period. Simifuga and pulsatilla are the other two remedies. Uterine hemorrhage, again, that is mentioned. It is active or passive from jolting while riding over rough roads and bearing down pain in the back. One of the top remedies to compare hemamelis is going to be ferrum metallicum or the ferrum group, where there is similar hemorrhagic diathesis and hemorrhages, and you can compare hemamelis with arnica and calendula for trauma and to quicken the absorption of the intraocular hemorrhage. So there will be cases which will be diabetic patients that will border into the eye damage, which is beginning to happen, or there will be patients who will have the complaints that are solely of the eye without any complaints of the body. There is an internal damage that is happening, and this remedy hemamelis, which may probably be on par or deeper than arnica, can be thought in such cases. So thank you all for joining, and if you have used hemamelis, do let me know in the comments, and we'll catch up again with the next set of remedies. Probably it will be Crotalus horridus. So stay tuned with the notification, and we'll meet up again and continue the last few remedies that are left from the Allen's keynotes.